Hello everyone. My research topic was Dandy Walker malformation. It was first described by Sutton way back in 1887, but a clinical description wasn't provided until 1914 by Dandy and Blackfang. And then after that, it wasn't until 1942 that Walker and Taggart further expanded the understanding and the description of this disorder. The current model of the disorder was created by Benda in 1954, and Benda was also the person who named the disorder after two of the aforementioned researchers, Walter Dandy and Arthur Walker. Some of the physiological features you'll see with this disorder, the ones I have here are the most prominent, however they are not the only ones, and I will explain others later. One of the most prominent is that the cerebellar vermis, which is the center of the cerebellum between the two hemispheres, is completely absent or partially absent or underdeveloped. And along with this, each side of the cerebellum may also be absent or underdeveloped, as you will see in an upcoming slide. You'll also see partial or complete absence of the foramina of Luschka and Magendie, and what these do is they help to drain cerebrospinal fluid out of the fourth ventricle and the brain in general. And so what this causes is a buildup of cerebrospinal fluid, otherwise known as hydrocephalus, specifically in the fourth ventricle and in the form of a cyst in the posterior fossa, which is the part of the brain that contains the cerebellum and brainstem. And this is what makes them both abnormally large. This picture shown, I know it's a little hard to see, but the large area in white represents the cyst formation in the posterior fossa, which is, again, filled with cerebrospinal fluid. Also indicated by the arrows down below, I know they are also hard to see, but that indicates a thinning of the occipital bone, which is caused by the pressure exerted on the back of the head. And also indicated by the C's, again, I know they're hard to see, but these represent the underdevelopment rather of the cerebellum. Now these next two pictures here, I have a healthy brain down below and a brain of someone with Dandy Walker malformation, and this allows you to really see what the disorder, the effect it has on the brain itself. Again, indicated by these small arrowheads here is the thinning of the occipital bone. The large black area is, of course, the cyst in the posterior fossa, and indicated by the B and the arrow just above the B here and here, it shows the brainstem and the cerebellum are far less developed and also are being pushed forward by the cyst in the posterior fossa. This last image I have here just represents more hydrocephalus in the brain. This still representing the cyst in the posterior fossa. However, these are the two lateral ventricles. As you can see, they too are being filled with cerebrospinal fluid. Now, as I mentioned, there are other brain abnormalities that you'll see, and these are only a select few of them. As I mentioned, there are many. One of them is the absence or underdevelopment of the corpus callosum, which is the part of the brain that connects the two cerebral hemispheres. You may also see a sac-like protrusion of the brain through an opening at the back of the skull, which is caused by that thinning of the occipital bone. And a third thing you may see is a failure of neurons to migrate to their proper locations during development, this being one of the causes of one of the symptoms that I will mention later. Now, before I get into the symptoms, I just wanted to go over the prevalence of it as well as how it may develop. It affects anywhere in between 1 in 10,000 and 1 in 30,000 newborns, so it's not extremely prevalent, but it is fairly prevalent. And it may be possible to actually see the signs of the disorder developing or its variants before the child is born. However, it's much more likely that you won't see them until the child is 1 year or maybe a couple of years old. However, 10 to 20% of cases won't show any symptoms until late adulthood or into late childhood into early adulthood. Symptoms in children may include increased head size and bulging at the back of the skull, which are both due to hydrocephalus. Intellectual or learning disabilities, which may be due to the neurons failing to migrate to their proper locations. Delayed development, and specifically motor development, which is caused by the underdevelopment of the cerebellum, and you may even see seizures. So some physical abnormalities you'll see in other areas of the body are heart defects, extra fingers and toes or fused fingers and toes, muscle stiffness and partial paralysis of lower limbs, malformation of the urogenital tract, which is the tract that encompasses the urinary system as well as the reproductive organs. And you may see abnormal facial features. Now, for the small percentage of cases that don't show any signs until they are teens or adults, you'll see headaches, vomiting, paralysis of facial muscles, poor muscle coordination, increased muscle tone and muscle spasms, and certain mental and behavioral changes. And these symptoms are less severe, but it is most likely because the disorder itself is less severe, as seen by the fact that it hasn't been shown until they're in their teen years or adult years. Now, there are very few options right now for this disorder. I suggest before you have children, if you can afford it, to get genetic counseling, as this can show if your child is at risk for inheriting Dandy-Walker malformation, or really any disorder. Now, Dandy-Walker malformation itself may not be of concern when you see the results of the genetic counseling, but that is because it's far more likely that it's a mutation in the zygote while it's being developed, and it's not necessarily going to show, it's very rarely inherited is what I'm trying to say. And right now, the treatment options are very limited. It can't be legitimately treated, but it can be managed. And the way they do this right now is through the use of shunts or a ventriculostomy, which are both procedures that are done to help drain the excess cerebrospinal fluid out of the brain. Otherwise, your child is most likely going to have, again, poor muscle coordination and certain intellectual and learning disabilities. So the best options you can do is get your child physical therapy and educational assistance, which they will need as they develop and get older. Now, as I mentioned, as of right now, there are really no permanent treatments, and there really are no extremely effective treatments either. But hopefully, with increasing technology and understanding of the brain soon enough, we may have better answers and therefore better treatment, not only with Dandy-Walker malformation, but with any sort of disease or disorder. Thank you.